It is my honor to introduce our esteemed oratory, Department of Health Research, Government of India. His pioneering work in infectious diseases, particularly leprosy and tuberculosis, has transformed medical research into public health impact for millions. Beyond his scientific brilliance, he is a mentor and a teacher, inspiring countless young minds through his wisdom and guidance. On this Teacher's Day, there could be no one more fitting to share his thoughts with us. May I now invite Dr. Geeta Mehendiratta ma'am, who is the chairperson in obstetrics and gynecology, to present the formal citation for our orator. Ma'am.
Thank you, Dr. Veronica. A very good evening to one and all. And it is an honor and a pleasure for me to read the citation for Dr. Professor V.M.KATOCH. Dr. V.M.KATOCH did his MBBS in 1974 from Shimla and MD in Medical Microbiology in 1978 from AIIMS, New Delhi. He is a distinguished biomedical scientist whose contributions have profoundly impacted medical research, public health policy, and scientific leadership in India. He began his illustrious career with the Indian Council of Medical Research under the Talent Search Scheme and went on to train at premier institutions in the USA and UK. His long and productive association with the ICMR began in 1978 at the Jalma Institute, Agra, where he served in multiple roles, culminating in his directorship from 2001 to 2008. He then took on the dual mantle of Founder Secretary, Department of Health Research and Director General ICMR from 2008 to 2015, during which he spearheaded transformative schemes like MRUs, MRHRUs, VRDLs and programs for human resource development and intersectoral research collaborations. These initiatives continue to shape health research across India till date. Dr. Katoch sir has held key leadership roles including President JIPMER Puducherry from 2019 to 2024, President at AIIMS Madurai 2021 to 2022, Chairman Lepra Society till 2024, and NACI ICMR Chair at RUHS Jaipur from 2016 to 2022. He currently serves as editor, Indian Journal of Leprosy, and he is the president of the Tuberculosis Association of India, and he contributes to numerous scientific and policy committees, including the Life Sciences Research Board with the DRDO amalgamation, the IPC, the NTEG, and MAHE. He is a pioneer in infectious disease research, especially leprosy and tuberculosis, and Dr. Katoch developed rapid diagnostics, DNA fingerprinting methods, recombinant RNA targeted probes, and indigenous DNA chips, and earning multiple patents. His scientific oeuvre includes over 350 publications and more than 25 major extramural projects. His work has elucidated novel pathways in mycobacterial metabolism, drug resistance, and taxonomy. His legacy includes bioluminescence assays for treating, monitoring, PCR RFLP for clinical applications, and innovative nucleic acid isolation techniques. Dr. Katoch's leadership at ICMR emphasized translational research, tribal health, environmental health, and vector-borne disease forums. And being a fellow of all 4 major Indian science academies, FNASC, FAMS, FASC, and FNA, he is also the recipient of over 20 prestigious national and international awards, including the Ranbaxy Science Foundation Award in 2004, Om Prakash Bhasin Memorial Award, and ISRH Lifetime Achievement Award in 2015. Dr. Katoch remains a beacon of excellence in biomedical science, institution building, and health research policy. We all welcome you, sir.
And now, the highlight of the evening, the 7th Gripmer oration. We are privileged to welcome you, sir, and we welcome you to speak on the topic Integrative Medicine in the Context of Health Need and Ethos of Contemporary India. Please join me in giving him a warm, heartfelt applause.
Professor Rana and the entire SIR GANGA RAM family. Dr. Rana, yes, he really, not only is, I'm like elder brother, but he's a really elder brother because distantly related to me also from my father's side, his maternal side. But then I think since 1970 when I joined the medical college, there's a time his mentorship began, as a elder, as a caring elder. Then, today is very fitting day that Professor Ganguly is here today. He's the only one in the entire audience who is in the real direct teacher to me. Entire career, the time I passed out from this place in 78. And I think he picked us up as very youngsters he thought that we had a potential, and he really shaped us up, me, my wife, and I think so many people he other shaped actually, but two of us are here today. So we really pay our respects to him as a teacher. We learned the administration from him, we loved the management from him. So we grew, not as a microbiologist I'd say, but as more as a scientific managers, as a persons. When Professor Rana was giving, that what a teacher is and what the role plays, and I think all of us, you agree, and so many others of other senior people who were on the dais actually, but there were three people who were senior to me, Dr. Nandi, Dr. Kusum Verma, Dr. Rana, they were the seniors. I think the other three were I thought they're younger to me. I think they are truly. Madam Sood is 1 year elder to me actually, so there are 4 were elders and 2 were youngers. But anyway, there's the question, it's not the age, but the question is young people, they really continue to contribute. They are not young actually, they are also very, 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 very senior. But there's the story of the entire audience today also, this represents generations. But when you think of this evening, why you were there actually? We were here because, yes, I'm known to some. That's why they thought of me. It's not something anybody is not exceptional, actually, nobody is indispensable. But then, yes, there, some connect with the system. Why these evenings are to be very special actually. You look at the SIR GANGA RAM's, legacy, beginning in 21 in Pakistan. That hospital continues to kick well. They have 831 beds even today. Their medical college continues to do very well, Balakram Medical College. So I keep on following that college also. When I look at this SIR GANGA RAM, I look at that also, same time. So some dreams of some, individuals, who have the charity in their mind, with the feelings in their mind, and they create the history actually. Coming back to the after partition here, the entire story begins here. The difficult times in 70s which you went through. But then, the examples of Dr. Mahajan was coming up, and I was following these actually earlier also. When the day I got the invitation, that is, I went into the depth also after that. Because you want to be connected with, it's not a one-day story. A story of more than 100 years. More than really 70 years in this country also, after the partition. But then, transformation from a hospital where your thing was only alleviating the suffering. That was only the patient care. But then to an institution who was thinking, igniting so many people, being counted among the best for the DNB students, not for today, for years together. You began perhaps in 84, but in the last couple of years, the quality, the output, that has totally changed actually, taken with the respect. So I think it is a continuity of the hard work of so many who are the teachers today, some are honored, some may not be honored today, some are senior sitting here. So it's a tribute to all of them. But then you're passing a legacy to a new generation actually. today people have come for degrees. They must have been coming today with some getting the awards also. But many of them have a goal in life. It is not a personal goal of just your own career as a specialist of a particular subject. That's okay. That's for you to very personal goal mean. But many people have a very broader goal actually. Nurture individuals, nurture hospitals, nurture systems, nurture create something else. And that's how these evenings are special actually. These evenings for some people they leave a imprint for future actually. I think that's the time to remember. I think the events and the Teachers' Day, when you kept this your own Gripmer oration this evening on that particular day, you have a very clear thinking in your mind actually. I think that's Dr. Rana and all of the people who have thought of this day as a Teachers' Day and your own oration on these days. You have a very clear thinking of what type of generation you want to produce. I think that message will go through the people also. They'll leave that imprint on many of the youngsters who are getting out, who are already playing. So I think that's something a future actually. Of course, you remember this is the 64th Teachers' Day for the Republic. A tribute to the Bharat Ratna Dr. Radhakrishnan. He's after the independence, he stopped writing the knighthood which he got, I think, way back in 20s. But look at the total, why the person is respected today. Why this is a question of values only. He is considered definitely, everybody says, one of the most distinguished scholars of the 20th century. That's some statement when it comes. It means actually. And if you look at what is done in his subject, the philosophy, in the Vedanta, yes, that is an imprint which those papers are cited even today. Look at it, put anywhere in the web, those papers are cited actually. 50 years after he's gone from this earth actually. I'm serving as the Vice Chancellor of the universities during British time. Prestigious ones, Andhra University, BHU for 10 years actually. After that, of course, there was a spell of, he's serving them as an ambassador to Soviet Union, but then Vice President, then President, and this is a legacy. But this is what, he had already learned and for which the society had honored him. But why, these are not the designations for which he is remembered actually. He is remembered for the work he did as a teacher, and he glamorized the teaching, he emphasized the point that teachers remain the most important. So I think this is the day to pay tribute to him. I join all of you. But then I chose a topic for this evening, which I have not worked actually. All the things in my biodata which were talked about, I have not worked on this. It's all my, I think, involvement as a administrator and as a policy maker, which you continue to be there after you leave the position also. Professor Ganguly is 12 years senior to us, but he continues to be playing the same role which he played years earlier also. I think that's how this entire thing came to my mind. A couple of years back, when the Niti Aayog was debating something, till that time, and I had this just in 2011, we were planning that 12th plan. Dr. Beliathan gave this term actually, integrative health. He wanted to be included there actually. Till that date, I had this idea never crept to my mind also actually. I'm telling you to be very frank. A senior man talking, a person who has been truly interdisciplinary, being a famous cardiac surgeon, an innovator, but a man with vast knowledge of the Ayurveda, Charaka, Sushruta, everything, anything. That impressed me, and I introduced that paragraph there. So integrative health became a part of our thinking policy for the Department of Health Research and ICMR system actually, that this will be something we will work on. But that was all, that's the big thing. But then we started something, but very little, because the time was not right for it. But a couple of years back, right in 2020, already the COVID had stuck. People were feeling again, that you need that kind of system. Niti Aayog started something. Then I started getting it deep into it, I'm telling you. So that's, earlier did I something as administrator, but then the depth started coming in when it was just only 4 or 5 years back only. Well, I think this is the definition which all of you know. That's here. This is a Western definition. You want to integrate the scientifically tested complementary medicine systems, which are many of them are practices, into already evidence-based modern medicine. So nobody is thinking of, that, I think this is not in the mind of anybody that anybody can think of substituting modern medicine at this moment. There's no need for it, actually. Nobody is thinking of that. But other people started realizing there is something beyond, there's something available and you need it actually. So this is a common word in the Anglo-American area, German-speaking countries, where the people felt the need. I'll come to those slides also, United Kingdom also. And here people want to look at, you look beyond a patient, it's a totality actually. That means the preventive, promotive, everything taken into that, where the other systems still have a strength because people survived without the modern knowledge for centuries. They did survive. They were healed. So that knowledge was not totally useless knowledge that led to the good health of the generations of people for centuries. Now you think of the need, you look at why. Because no system of medicine, including modern medicine, will be perfect for a number of conditions. All of us know it, whether you are a dermatologist, you are a nephrologist, or any specialty you are. You know it actually, where our end point comes, nothing beyond. So there is a scope of complementarity. We have to search for it. While that huge number of, I think, publications have appeared on allopathy and acupuncture, and I'm seeing that Dr. Raman Kapoor sitting here because for a number of years he was pushing for that change actually, and he did succeed. I'll come to that also later. And this area, people across the world, mostly allopaths, had published a huge number of papers on the different applications. Then yoga and allopathy also. There's a huge evidence. Some very strong, some medium, something low actually, but it is there. For others, that on the complementary system, the data is not that great actually, but on their individuals, I'll come to that. So, but you feel the need for cancer, you need the feed and diabetes, you need for the hypertension, several other conditions, where it's a long, you can continue fighting till the end actually. You succeed also, but otherwise you keep on fighting. So this thought of integration, this is again I flag out, this is not a new idea at all. It was thought long back actually by Indians also, but it didn't come up. That's why I'm saying why to this topic today, because the time is ripe for the change. This country is changing, so many of us should think, do we see opportunity to contribute? That's the point I'm taking. The Western side, how they look at it. This is one from the review I've taken. See, it is an ambitious, noble-minded attempt to address the shortcomings of current public health systems in Western medicine. This is one of the very finely, highly quoted reviews. Now, integrated medicine, what it employs? Useful therapies from China, India, this is exactly the same word I'm saying. Then you combine with the modern system, wherever the modern system doesn't succeed. So I think they call upon that irrational fight between their systems should stop. Wherever you can contribute something, you should consider. It's not something nobody can force anything on anybody. When I looked at, again this is a story of the 31st August, because I prepared these slides in the last 3-4 days only. Then more than 92,000 hits you find in the PubMed on the integrative medicine and the integrated health. Not all the papers have done on that, but they have mentioned it. Then you look at where the vaccine thing comes, pain management in cancer. Lot of RCTs, the literature on hypnosis, acupuncture, music therapy, mindful meditation, yoga, Qigong, second type of the Chinese meditation, the Buddhist meditation, and which some reduce the pain, some reduce the anxiety, but they make a life betterment for the change actually. Your quality changes. Mind-body approaches, including meditation, yoga, they have shown a very different effect actually. Particularly in the therapy also, like when you have due to the toxicity of the aromatase inhibitors, musculoskeletal symptoms, hot flashes, lot of oncologists sitting in this audience, they will be knowing what happens there. So these therapies, they make a difference there actually. Fatigue is a common in the therapy. Okay, there a lot of reviews that tell, systematic reviews that tell that they make a difference actually. So the CAM in oncology is already there actually. Germany, the data shows there are 40 to 70% different publications. They ultimately go there, whether they get anything out of it or not, but they go there. It varies from 5% to 90% in different countries actually. But their doctors don't recommend, because you don't have, either you have ethical issue, should I recommend or not recommend, or you don't have faith in that, or you don't have information about that. Now, acupuncture to reduce the effects of cancer treatment, yes, again, it's proven actually. Not one publication used. This again, the systematic reviews, meta-analysis, they all show the effect actually. Nausea, vomiting, the should be the cancer therapy, you can really take care of it by phytomedical approaches. A number of them. Again, there's a lot of evidence on that. In the Indian continent also, India per se also, people have tried others. But I think I'll come to that when you see the evidence. People have tried our own indigenous systems. People have tried the naturopathy approaches, Reiki, and massage, yoga, meditation. But they say the evidence is that we have not reached the stage of making recommendations. But this, CAM started increasing from 25% in 70s to 50% 2000 and more than 60% 2010 in cancer. Now the situation is changing. A lot of the chemotherapeutic or immunotherapeutic approaches are emerging. So I think it is not growing any further. But anyway, there's still the need is there. The number of experiences I got on the GI disorders, particularly inflammatory bowel disease, excellent reviews on that. Headaches, migraine, there's a lot of all these systems have shown effect actually. Now, cognitive decline in the dementia patients, these therapies make a difference actually. So, very bite. Yoga, when I again put it, 38,045 hits. Decided again search on 31st August. So that means so many publications have mentioned this. Huge number have used them up. So LD saw about 20% of them, the yoga study was there actually. People are using the lymphedema gate problems, people are using the urinary incontinence, osteoarthritis, chronic low back. These all when I'm showing the example, there are positive examples. There are some with a low evidence also, but these are all positive examples. Some places like in Italy, they are the recommendations, these are the protocols for the people who have to stand like dentists. They have protocols of which asanas do they use actually. Clear-cut effect actually. Reduces the problem from 80% to 15%, 10%. So I think whether on the preventive side, promotive side, they work actually. Diabetes and lung health actually, they have shown effect. In insulin resistance, they have also shown the effect. Again on the chemotherapy in the breast cancer, as a complementary medicine, yes, they do make a difference, no question on that part. But nobody recommends them as a standalone. They are all as a complementary, but they make a difference to your outcomes. Now this Niti Aayog story which I said, which I was a member of, I chaired the committee on the research. Other committees were chaired by very eminent people like Guleria, Dr. Sareen, Professor Guleria, and a number of other people. They were all allopaths actually. Do I tell you that this was not a vice or a pushed by a Ayush or other people. All committees were headed by the allopaths, and we looked at the evidence. Who looked at the evidence? Who created the evidence? They are CSI institutions. So it is not something coming from out of blue by somebody who wants to push their way. No, not that way. We looked at the integrative health systems as an approach. We should be interdisciplinary, intersystem, translational, and we should look at only identify the lacunae and inadequacies. It is not something to be, like a political, religious or emotional appeals. You look at where you need it actually, where it works actually. So I think the question was the medical outcomes. Better health outcomes was the only goal. When you look at India, yes, besides allopathy, Ayurveda, Siddha, Unani, homeopathy, yoga, naturopathy, Soharipa, these are the recognized systems of medicine for which the system exists. Since 2003, acupuncture and hypnotherapy recognized the mode of therapy. Committee chaired by Professor Ganguly, and that's about the last recommendations including any system. So these are 2 were approved out of 18. There were 2 were approved as the mode of therapy to be practiced by the qualified people. Because that's the only. His files were very particular. He was very strictly to the scientific content and the merits. He wanted the citation. He wanted the index, where it published, what type of evidence. So those files in the ministry they really speak out how things were approved actually. So these 2 continue to be there even today. Acupuncture again later grew as a system of therapy. Lot of work happened all over the world. But in India, I think Dr. Raman Kapoor and there were about 15 other people. They all pushed for a review again and again, approaching the ICMR, DHR, everybody. So they were pushers. They wanted the reviews. But again, the beauty was that most of them, more than 90% were allopaths actually. I think so. There were many of the professors, senior professors in medical colleges. So I think this led to its upgradation as a system of therapy. Again, to be practiced by qualified people. Again, the advice, everything is by medical people. But certainly a sphere of application broadened considerably. Now, issues, what are the issues? Partnership should be scientifically and ethically justified. Nobody can ever, think of recommending anything which is not scientifically evidence-based actually. If it comes to me, my patients, myself, whom I'll get treated, which method, certainly there should be evidence for that. Now, evidence in case of modern allopathic medicine, you can search in the peer-reviewed journals and you can find it there. And that kind of thing also evidence of people like Dr. Nandi, I was seeing, very nice to see the dice, share the dice with him. We always listen to him to those standards of publication, how what should be there, Booker T. So that's quality is issue actually, and that in allopathy. In India also some journals are reputed. IGMR is there, medical journal, which he edited for long years. Many other journals, but outside India there are a number of journals which are reputed where you can't publish anything, trash actually. Our own professional societies journals are reputed, most of them, and many of them do an excellent job. So allopathy, you can search for evidence somewhere, you can then collate it come out with the reviews. Problem occurs with the other systems, because many of them may not be in the recent publications, they are in the textbooks, but that you can't really apply it directly. But situation is changing. I'm saying several RCTs are available. This we came to when we did the search in this 2023, again done by CSR institutions. They did the search. This was in again August of 2023. This is the last date. This is the slide from that around that time only. There were 709 RCTs on these systems also. Ayurveda on that, yoga actually the second. Yoga was on the top. 309, 232 on Ayurveda, homeopathy also 139, Unani 29. So that means these are not the system, useless system without where nobody is changing. They are changing. And there are a number of indications for which the trial, the size number, it was good enough actually. So I think that evidence is accumulating. There is something, a time to think something. There's in the today's context also the data is there. Look at, on Ayurveda till 23, that's the maximum, again the areas, musculoskeletal disorders, people maximum come there, they have done a lot of work on that also. I'll come to that, that has evolved great further also. That way, number of other dental problems, metabolic disorders, psychological issues, respiratory problems, huge number of trials. Homeopathy is the same story. Homeopathy, even the developmental disorders of the children, there are a lot of very good RCTs on them also. Musculoskeletal disorders also. Gastrointestinal disorders also. Now, acupuncture, this is the big range of things actually. This again all came, the search came and because they were pushing for a change. I personally did this search actually, I'm telling you. They presented some papers. But then, because I really don't look, until you see something, I don't accept that. There are more than 100, outside India, a huge number. But even that time in 2018, more than 100 papers in the peer-reviewed index good journals, which are there in the PubMed at that time. And I think that's how we came about. So these are all indications for which the good publications exist actually. So you could be sure enough to make a recommendations on this. If something is the same thing done by, let's say, 10 people independently at different places, yes, and it's worth trying, it's worth seeing actually if it changes your quality of life, your therapy. Now look at the CCRS, again the Central Council for Research in Ayurvedic System, which is, the 6 councils under the Ministry of Ayush. Ayurveda is one. They had a data, they are small setups, 1-2 doctors here and there, but they had a data from 1992 to 2012, you see the osteoarthritis, neurological disorders, skin disorders, cough. This is the order which the vaccine people come to their clinics. These are all clinics of their CCRS, like ICMR. Now they have a portal also, Namaste portal. And that portal again maps who are going to them and what is happening to them. So that entire data of lakhs of people is there with them actually. Again the same story, same osteoarthritis is the highest, then the rheumatoid, same order, slow and so it starts getting there. So this much number of people go there. And their record is there, what happens to them, how many got cured, how many really permanently cured, how many they could avoid what they got, some who were treated earlier by allopathy or who had to really switch to allopathy after that. So our entire record is there actually. So this is all scientific based actually. So this Namaste portal, which this is National Ayush Morbidity and Standardized Terminologies electronic portal, which is a government portal, and this a number of this is not entire countries by data, but it's what 200 I think institutions are giving the data there. The entire data is there. It's published again 2024 again, and I think that you see the same story, the same profiles. That means for consistently for number of disorders, people avail those. Now like this, look at them. Most of them go to Ayurveda. Number 2 is Unani, then homeopathy, then Siddha. Yoga, naturopathy, entire data, unfortunately, they are not really submitting there totally. So what we did was, when this entire debate was going on across the country, and I think a large number of consultations were done with the people across the country, different institutions, different states. We thought, they prepared the teaching programs, training programs for the professionals who would like to work with each other. Where the people are establishing centers, they should have some training where either patient goes here, what happens to him or her actually. And why are you, when you think your therapy is not working, will you recommend? Will you say, okay, there is something data, you can go there. So then there are a number of things for which the teaching, training, fellowships, all have been designed actually. They're all recommended by the committees chaired by Professor Sareen, Professor Guleria, and a number of the senior colleagues, all from the allopathy side. And then the guidelines, integrative protocols, for which already some have already started coming. But one has already come, but other will be coming. So that is on where the evidence is there, huge evidence. I said about 709 trials, RCTs were there till August 2023 actually. Now on the preventive protocols, public health measure, lifestyle interventions, again a number of things have been identified for geriatric population, which is huge in this country. You want them to be really getting the relief at their home. Psychiatric problem, pediatric problem, where the child developmental issues are there, which are not beyond the nutrition, which are much more than difficult or complex than that. Number of disorders where we know the problem: autoimmune disorders, vascular conditions, neurodegenerative, chronic kidney disease. There you need evidence. It's definite evidence at what stage you can go. Either after failure, can it be early enough? When? So for that, use the modern biology tools as well as the clinical approaches of both the systems, 2 systems, 3 systems. And then you let it, whenever the evidence comes, you think of it, either using it, recommending it to each other. That's the kind of a roadmap has been considered. Now this entire genomic based work on the Ayurgenomics. Our Prakriti story, everybody knows. The Ayurveda people classify the people based on their Prakriti. This is all evidence proven by the Ayurgenomics also. Clear-cut profiles, they tell you your genomic structure is that way, your profile is that way. Epigenomic, now the beautifully epigenomic function, that those data is also matching with that. You can bring the like a reversal, you bring the reversal in the drug resistance to chemotherapy in cancer. You show that change actually. So that all is evidence-based actually. But memory enhancing drugs, for the mental health, for degenerative disorders. So for that to generate enough data for tomorrow, if you can have easy leads already available, which you want to prove scientifically, yes, see it, validate it, and then start considering it. Number of centers have been funded. ICMR has again funded centers in AIMS, 3 centers, one on child health, musculoskeletal disorders, another one is on the integrative therapies. AIMS Jodhpur, AIMS Rishikesh, AIMS Nagpur, they're all functional now. Integrative oncology, again this is an institution which is a center has come up in the NIC Jhajjar. All India Institute of Ayurveda has. These are all interdisciplinary centers where the people across both the modern sciences and their sciences, they work together actually and generate the evidence for the application. Now, Center of Excellence by Ministry of Ayush have been funded and enhanced. I'll tell you, this is one of the exemplary place. CSIR institution, JNU, IITs, Tata Memorial, Indian Institute of Science, Jamia Ahmedabad, ILBS, these are all list actually. So I think that's the reason they prompted me to choose this as a topic for this evening. That means this change has taken now. taken by a government push, because I was in the Ministry of Ayush, their reviews. I was seeing some of the states are just beginning, but some of the states are far ahead actually. But everybody is forced to talk today because the government on the top was thinking, yes, you have to consider something to Ayush centers. So that means the structures will be available tomorrow. If you want to, they want a cross-talk, it is not a ground zero. There will be people to talk to. And they will all have a IPH standard for the therapy, for the infrastructure, for everything. But I was telling you this history, which is history is something which which tells you why the roadblocks are there. 1925, that time the Congress Adhiveshan, chaired by again with Mahatma Gandhi as the president, and they said that's when the India attains independence, we'll push our systems. Whether it was a nationalism or it was a faith in them, because Gandhiji himself didn't believe in any pathy actually. Himself, his own life, his own imagination was very different actually, how you to be healthy actually. So, but this was there. He started a school of medicine. This again Kilpatrick Medical College, I'm telling you, which later came. 47, it became the number of committees which recommended. It became a College of Indian Medicine. 48, but this very funny combination, where the allopathy and you wanted them to teach, they know allopathy for 3.5 years, then you have to read the Ayurveda, Siddha, Unani, choose one. In a way, I think it failed actually. And I look at it, this was born to fail. Because in 1 year you cannot make a person trained in both systems. So I think this is a imagination, a dream, but didn't catch up. Because became a College of Integrative Medicine in 53, but then later those people were not getting any openings anywhere actually. So by 60, 65, this had gone back to the MBBS only actually. So I see the point was, they attempted something, emotions were there, feelings were there, but it was really not a practical approach, So neither you become a allopath nor you became a qualified person actually. So I think the system failed actually. But I think times have changed now. USA, Europe, yes, our own USA's, the NIH has a big major system on that, National Center for Complementary and Integrative Health. The 170 millions were the fund even for the last year itself. There are centers in the Norway, there are centers in the Sweden, centers in the UK, centers in Germany. So they are all looking at evidence. Nobody is saying you do this actually. They are all looking at where one doesn't work, is there evidence on the other side? And if it is there, yes, then you consider it actually. That's the point which they are all working on. In India, again, I gave you the story from the beginning of the independence. After that, from everywhere, it was mentioned. Ayush was mentioned, but very little. Only 3% of the funding for that actually. They found Ayush in 95, 2014 when this government came, big push, ministry was created. By 2025, there are more than 33,800 hospitals. There are actually 3,843 hospitals actually across the country. More than 38,000 dispensaries, more than 12,500 Ayushman Arogya Mandir, which have a beautiful system actually. So there now a system is there to cater to their needs. Now the data is documented. There's something, outcomes are also known. And they are proposing an excellent model of integrate when their evidence is there. The legally regulation, that is something we have to bring out, and they are approved actually. So today's India's ecosystem, you talk of today's India. So okay, all problem we face, every parameter has improved, but the problem right at the pediatric level also, the development disorders, the malnutrition, so many things, they are huge actually, not a small number, huge number. People either survive. If they survive, they may not be lucky enough because they will survive with a deficiency actually. They have developmental disorders. We have a genetic agitation, the population which we have no resources to tackle with. So this is a problem everywhere. But the ecosystem today, in like 65.8% of the district hospitals, you have a co-location. That means they are present with each other. Community health centers, again a presence in nearly half of them. So they are there. NIMHANS has taken the biggest lead. AIMS Delhi has also contributed quite a bit actually on the number of the interventions based on the yoga and the Ayurveda. But NIMHANS has proven a point actually, clear cut. They have created a system, both for the psychiatric care and the neurology care also. You know, where the Ayurveda person, the qualified allopath, they work together actually. Yoga is of course I think a non-religious thing which is adopted by everybody. So I think it is taken care of that way. So their department of integrative health was the, integrative medicine was the oldest. They have a PhD program, they have other fellowship programs. So they have created a systematic model to do it actually. Luckily it was led by all allopaths and they did generate the evidence and they have moved that way. That kind of systems may be possible elsewhere, they are trying for that. Wide acceptability. As I said, there is a contemporary evidence is available for several conditions which I listed to you. I'm not saying talking of any particular condition here and there because 709 RCTs I talked about. There is a complementary between yoga, acupuncture and hypnotherapy. There is no competition. So that's people ever see a cost benefit of adding something if you want to. National health policy again gives a lot of push. Luckily the same government is back again, so they have made a push on the states also, wherever they have put the money also into it. So it's no longer a situation where the Ayush people have to beg for something. They really have plenty of resources. There is a system from the top laid down, you know, headed by a technocrat down the line, where they're looking at the quality, they're looking at the measurements, they're looking at everything actually. No, this DGS, this is the biggest thing I saw, which I learned only day 4 yesterday. That's why I put the slide also. DGHS has already come out with the guidelines. You go to the website of DGS. For the Ayush vertical, they have a guidelines for the musculoskeletal disorder. I checked, for which I have a huge number of trials. So there's evidence was there. So that evidence has been converted into a guidelines. Diagnosis, everything, assessment has been done by allopathic methods. And then the guidelines to be managed them by Ayurveda, Unani, homeopathy, Siddha. So if you find the patients are not responding to your, what you want to do actually, you can consider that. Those are the guidelines approved by approved by our own allopathic system. Same with the guidelines for elderly care, tobacco cessation, and again I think a reduction of the AMR, which is more of a promotive story. That's coming up. I've not read them, but these I saw on the website also, and I think I've included as a part here. Now what are the challenges and barriers? Is a variability in the philosophies, disparities in approach to the conditions, many conditions. People try to use that mixopathy, which is really produces a lot of damage actually. Nobody can be a specialist of anything actually. So preventing cross practice is very important. But then for cross referral, there should be guidance. Who will rep them? Who will take the responsibility? What is the accountability? What is the ethics actually? It is a question of patient safety. It is a question of your confidence. So I think those are the issues which people have to resolve actually. Now you look at that priority setting, by and large it has been done, how it should be done. But it will evolve as more people will put their ideas. But the framework by the government, Niti Aayog has done right from 2018 to 2023, 5 years of deliberations. So they have the material is ready. So it is a partly done. Scientific agenda, again partly done. I said nothing doing. A few people, 20, 30, 40 people can't be in a knowledge house for everybody. But this is some material is created actually. Now, synergizing the system, political administrative support for making those regulatory things actually, ethics issues. I think those are still to be done, which I think many of you, the younger generation, will have to resolve. But it is all on the move. So when you look at the future, moving towards harmonized working together, focusing on complementation, where there are gaps, felt needs, and evidence that it is a worthwhile. I think it has already begun, and what is gaining momentum. That's the reason of my putting you this evening to this topic, because I looked at it from purely on that angle of a scientific analysis from the ringside view. I was not a part of I was not a promoter of anything, but I saw that a huge thing exists actually. While the methods of assessing side effects may be different in various systems, outcome indicators will be the same. If it is a promotive health, good health means good health actually. You are getting cured means getting cured actually. So that you have to find the markers for a crosstalk actually. And I think based on that, the number of intervention tools, strategies, are available for many others need contemporary evidence and experience, but that all has started emerging. So I think I'll close with started with one teacher, Dr. Radhakrishnan. Dr. Abdul Kalam again remains a very inspiring figure, from children to seniors, everybody. His personality was like that. So I think he had a number of quotes, but this quote I've been putting for a number of years. Dream big, back it up with clean observations, hard work and diligence to achieve it. So certainly we can do it. And even the dream of the useful integrative medicine, useful harmonized functioning for the betterment of everybody, that is clearly available. Opportunity is available. Now which one do you choose, which one you decide, which one you think is useful, that's yours actually. But I said, the gaps exist in many places. We have listed, I gave some list of the things already identified, but there could be many others actually. See, for example, there is a genetic disorder. Suddenly at the age of 25 starts manifesting. But if gene was there all the time. But it started manifesting in 18 years, started 22, 25. What that means actually. Epigenome was managing till that time. Epigenome started breaking down. Why it started breaking down? If in some pathy, in some of the systems, some promotive things exist actually, by that if that dystrophy could have been postponed by another 20 years or permanently stabilized, you could have done the game actually. You're going to the gene therapy, you're going to those things actually, which is a good, there's a great idea that they should be made available. But promotive, preventive therapies which existed in the ancient literature of not only India, other therapy, other systems also, I think they're worth looking at actually, how the people survived with that actually. So I think a science tools should be modern, the way of assessing should be modern, but if evidence exists somewhere, yes, you validate it and use it. I think that should be the approach, and I think that's a call for the younger generation to think about, be open. You can be part of the changing story. India is changing, we are changing, there's a push. And that push will sustain only if there is a truth in it. So I think there's an opportunity in it. So I think I'll close my remarks that integrative medicine approach provides an opportunity to think differently, contribute where there are very solid roadblocks in curing many disorders, in preventing many disorders. I think that applies right from the genetic to epigenetic to other things. But the opportunity is very clearly there. Best wishes, Jai Hind.